alcohol addiction comes to make chronic recurring disorder related to compulsive alcohol consumption, where the person has trouble controlling what they drink, losing control. The person needs to drink despite knowing that he may have different kinds of problems such as social, family, work, health, etc.
Etiology: alcohol consumption occurs due to dopamine release, inhibition of calcium channels, and methyl D-aspartate glutamate receptors GABA potentiation. When consuming alcohol, sedation and euphoria occurs due to the release of dopamine. Likewise, due to the decrease in dopamine levels, calcium channels, and D-aspartate receptors and GABA decrease, which causes the desire to consume more when drinking chronically.
Physiology: chronic effects. Drink alcohol in large quantity for prolonged periods cause liver disorder. For example, fatty liver, alcoholic hepatitis, cirrhosis, coagulopathies, bleeding for trauma, digestive bleeding, gastritis, pancreatitis, peripheral neuropathy, cardiomyopathy, brain damage, serious, and some cancers. Epidemiology: the WHO established that there are 283 million people with addiction to the use of alcohol in the world. 8 out of 10 are men. Alcohol addiction causes more than 3 million deaths a year. One death every 10 seconds. The main risk factor of death in men between the age of 15 and 49 is school consumption.
Signs and symptoms: drinking alcohol can cause acute effects. This occurs as it is consumed. Chronic effects that will cause more serious effects than usually occur in the body. Toxicity and overdose that can lead to death. Acute effect in breathalyzer symptoms increase proportionally as the person drinks alcohol. From 20 to 50 milligrams in deciliter produces calm, mild sedation, and decreases fine motor coordination. From 50 to 100 produces impaired judgment and further reduction in coordination. From 100 to 150 can cause unsteady movements, altered speech, lack of inhibition in behavior, and memory impairment. From 150 to 300 produces delirium and lethargy. Toxicity or overdose can occur when a person who does not drink alcohol reaches levels of 300 and 400 milligrams per deciliter, which causes unconsciousness, and if it's greater than or equal to 400, it can cause sudden death. Withdrawal can lead to signs and symptoms of hyperactivity. When it is mild, it causes tremors, weakness, headache, sweetness, hyperreflexia, gastrointestinal symptoms, tachycardia, high blood pressure. The symptoms begin within 6 hours of cessation of consumption. After abrupt cessation, excessive and prolongation alcohol consumption, visual hallucinations occurs within 12 to 24 hours. These are characterized by auditory and visual illusions and hallucinations.
Symptoms: alcohol addiction can be mild, moderate, or severe. The signs and symptoms are inability to limit the amount of alcohol to be taken, want to reduce the amount of alcohol you drink, white being ability to drink of the long time, feel like drinking alcohol, failing to meet obligation at work, school, or home due to drink alcohol, continue drinking despite having physical, social, occupation, or interpersonal problems, not having social and work activities, drink alcohol in unsafe situations like driving or swimming.
Diagnosis: constant smell of alcoholic beverage, not having an appetite, and there are gastrointestinal disturbance, not remembering what happened the day before, character changes, denial of problem, sleep disturbance, watery eyes, redness of the skin, incoordination, drinking excessive amount of alcohol, social, family, and work responsibilities are not fulfilled, not being ashamed of sexual impulses or aggressiveness, existence of jealousy or persecution and depression, destructuring crises and mistreating the family, abstinence, poor performance, greater accidents at work.
Treatment. They include medication and behavioral therapies. They may also benefit for attending a support group such as Alcoholics Anonymous, drugs that can treat alcohol use disorder. The doctor can point out which is appropriate, and there are three. Disulfide produces nausea and raiding of the skin every time alcohol is taken. Naltrexone inhibits receptor in the brain that make you feel good when drinking alcohol. Again, prostate, avoid taking alcohol again after quitting.
Behavioral therapies to treat alcohol addiction. A field professional intervenes who help determine and change behaviors that motivate excessive alcohol consumption. Cognitive behavioral therapy to determine feelings and situations that motivate excessive alcohol consumption to help cope with it. Motivational enhancement therapy to build and strengthen the reason for modifying the drinking habits. Marriage and family counseling done with family members to repair and improve family relationship. Brief interventions between 4 short, individual or small groups counseling sessions.